So the COVID-19 pandemic is still real, it's still with us. Actually, we're in the second wave of the pandemic here in Ghana. This edition of the Citi Newsroom, we're moving across the health sector, meeting men and women who every day have to contend with this pandemic. But the interesting thing about these men and women in the health sector is the ones that you don't even know they are actually fighting the COVID-19 pandemic because they are the backline workers. Stay with us. Hi.
Hey, hello.
Can I say?
Hello, police officer.
Thank you. How is work?
Oh, we can't complain.
Oh, right. So this is your office?
Yeah, that is my small
Okay.
office.
So every day you start from this point?
Sure. This
Okay.
is where I start.
All right. Okay, so can we see how the day starts from you after you leave this place? And then we'll come back and have a chat.
Oh, okay. That's fine.
Okay. Thank you. Okay. Thank you. So how many of you are here?
We are about 10 in this department.
Okay.
And because of space constraints and what we are dealing with COVID, we are breaking the team into two.
Okay.
And so we alternate
So
every
5
other week. So when we come this week, next week we are off, and then another team with my deputy will also come.
Okay.
But because of my specific roles that I play, I had to come
Every day.
every time.
Okay. Do you guys work on weekends as well?
Yeah, we do weekends.
Okay. All right. Okay. So this is a point where if I'm doing a test or
Yeah,
this is
the engine room.
Okay.
Our interaction with clients is at the collection point,
Okay.
where samples are taken and also results are dispatched.
Okay. So what kind of tests do you run here? I know this hospital also focuses on antenatal and all that, but what are the main tests you see in a day?
So we do the hematology, full blood count, and then we do basic microbiology, stool RE, urine RE, and some essential serological tests, i.e. hepatitis B, typhoid.
But you do not do COVID tests
We
here?
do not do COVID tests here. We don't do COVID tests.
Okay. All right. So let's see the other places here.
This is supposed to be the waiting area for our clients.
Okay.
The waiting area. So the client drops his request. He drops the request in the box here.
Okay.
Then we pick it up, we register, and then we identify the client by name, and then we sort it out.
Okay. So these are usually stool and urine
Stool,
samples.
urine, and then we take blood sample to here.
So we know COVID can be pretty interesting. I mean, asymptomatic, and there are some who probably have gone to the hospital because they think it's a common fever or malaria and all that. For the contact part, which is one of this area of the blood sampling, critical, how do you guys protect yourself?
So the protocols that you know of are the essential things we apply to protect ourselves.
Do you worry for your staff?
Yeah, so naturally we will all be worried. And that is why we encourage our staff to put on the protective gears, i.e. the face mask at least, your lab coat, and then you wear your examination gloves, because the COVID is said that you will not know who is carrying it to the extent that is asymptomatic. And I can share my personal experience with you.
Tell us about it.
At the peak of the COVID last year, where we were very much involved in contact tracing, we went to take a sample. When we went, the guy who met us on a motorbike and took us home to go and take his brother's sample, who was very ill. When the results come, surprisingly, his brother, very ill brother, tested negative. And the one that led us seemingly healthy rather had a positive results.
Oh no.
Now, naturally, if you had loose guard
Yeah.
and said that, oh, but this guy is fine, and you had dropped your face mask to talk clearly to him so that you can hear him, you would have gotten yourself infected in the way.
Yeah. For people who say that, the COVID-19 health workers, there are two, one at the front line, the others. What do you say to such people?
So for me, that argument is completely misplaced. To the extent that we are all seeing the clients, and some clients may be asymptomatic, not presenting with the cardinal signs that you expect. It means that we are all at risk. And so we, you can see as laboratorians, are even a step further exposed. And you would have wished that we'll get the appropriate, mask N95, but sometimes because of constraints we do not have. You can see that I'm managing
I
with a
can
cloth
see you.
mask.
Okay, we can move on. I can see you in a in a cloth mask, and I'm wondering. I mean,
Sure,
is that good enough?
ideally we are supposed to get N95
Yeah.
because of our particular work that we do.
But why not? I mean, we cannot trade health for money constraints. That excuse,
Well,
right?
unfortunately, it's not available. And so if you are wearing N95, then you should cough it out of pocket.
So after you're done with that, then what next?
So after we are done with the sample acquisition, it comes into the main lab, and then we sort it out to the various benches.
Okay.
So if you are doing full blood count, it ends up on the roller there where we mix the
Okay.
blood.
Can we come and see
Yeah,
that?
you can get inside. So if you are doing full blood count,
Okay.
it ends up here in the tube, and then we put it on. Well, so this is where the blood is mixed thoroughly,
Okay.
and then after mixing it, it goes through this machine, and the results is generated.
Okay. Okay. So this is done within, or it depends on the test.
Yeah, so this is done here, and there are other tests that comes with full blood count.
You go home to your families and all that. I mean, how do they feel with you being in the front line?
When you go home, you can see your family very scared of you, avoiding you like a contagious disease. And so what we did was to get a separate room for me. Those were difficult moments. See your young girl coming to you and you are trying to repel.
So those trying times was God. I mean, the fact that you had to work to survive, and the love for your family that kept you going.
Sure, of course, that was the greatest thing. And I think that government also put some important structures in place, i.e. the 50%, which some of us never got because of a certain weird interpretation that was placed on
Okay, so
frontliners.
for the lab guys like you are not part of the incentive package.
Well, per the definition that was placed on the 50% frontliners, it was suggested to me that those that were at the management centers, i.e. the Gun East and those
Really
places.
within
So
the
we were
okay.
maliciously sidelined with the 50%. But we are grateful for the tax waivers that was extended to all health workers, which we benefited.
The second wave, COVID, which we are seeing this year, what are your thoughts around that?
Well, I think that it was largely self-inflicted. We went into some campaign and we lose our guards. We're sending the wrong signals to the people out there.
We're still at the Lekma Polyclinic on our story on the people behind the scenes that you don't see but have to grapple with the COVID-19 pandemic. We'll bring you more. Don't go away. Okay. So I'm coming to another place. This is the OPD. This is actually the first point of call for anybody who visits a health facility. The workers here are the people you interact with, but they do not really know whether you have COVID or not. Let's speak to these people who are also very important. And in the era of COVID, how worried are you in their interaction, not knowing what anybody has?
In fact, we are very worried. Look at the space between us and then the patient. We don't know who is suffering the disease. We only take their names and everything. Then we don't know who is having, who is negative or who is positive. They even go through and then sometimes when they come back, they test positive. We are very worried, in fact. We don't have anything. We only have our nose masks and then...
And how do you feel the fact that you people are not placed within the frontline workers, but, not part of that definition, knowing very well that you interact with everybody every day.
Like I said, it is the first point of call. At least we should have been like a frontliners who are taking the 50%. We are here, we see to them before they will pass through. And then our nurses are, some people are frontliners, they've taken them as a frontliner. But look at how we interact with the person. We can easily get the disease from them.
You have family.
Yes,
How does your husband feel knowing that you're in the midst of all this and your children?
sometimes when I get home, they will tell me to just take off my things before I get inside, which is, So yes, we are managing small.
Yeah, they're worried for you.
Yes, exactly so.
So my next point is optometrist. Let's find out what that is and what that entails. Hi. So your profession is quite a mouthful. What really is it? What's the name, and then what does it entail? Because we all talk about optician most of the time, but this has more, right?
Yes, so I'm an optometrist, a doctor of optometry specifically. Basically, I'm a primary eye care provider. You can think of me as the first point of call for any and all eye complaints or requirements. Right? It's my job to sort out the people who require further treatments, whether that's medical or optical, and then I refer them towards the professionals who they require to sort out those services.
Okay, so COVID-19, last year by now, it had struck us as a country, I mean, coming from China and all that, and we're all over the place, worried for ourselves and all that. How did it get to you, knowing very well that the kind of job you do, you also have to come into contact with people and sometimes quite a bit of closeness?
Yes. So it's definitely had an impact, I have to say. For one thing, we've had to reevaluate some of our practices, some of our procedures. For example, as you said, some of our procedures require close contact, right? We've had to modify that. Now, we definitely try to prioritize the safety protocols when it comes to COVID. We were already disinfecting all of our instruments, but now we are doubly sure that we disinfect the tables, we do it in front of the patients, we disinfect the frames, the lenses, whatever else it is that they're going to use, and we do it in between customers or patients, right? So disinfection for one patient and for the next patient.
Did you ever have a case where you found out later that the person could have gotten it but was probably asymptomatic?
Well, none comes to mind at the moment, but I do know of people who came in knowing their status, right? But they were stable, shall we say, and we just made sure that we kept the protocols up as best as we can.
Do you have family, and how were you able to manage the fact that you may come into contact with people by way of your work and protecting your family at home as well?
Right, so I guess the first thing is you try to be honest with them, and then you tell them what's going on. You let them know beforehand. You make sure that their protocols are also up to scratch. And as best as you can, the moment you get home, get rid of your, leave your shoes outside.
So you were the type who was taking off your shoes, your clothes before you get in? Okay.
Well, maybe not necessarily my clothes. But yes, the shoes stay outside,
okay.
Right? It's an immediate shower, right?
If you look at how people in the industry, for example, those not necessarily in the front line, dealt with it, on hindsight, do you think things could have been done better?
I think after a while, the sense of urgency has reduced, right? And people seem to think it's over, or it's about to be over, but nobody is considering the fact that there can be waves, a second wave, a third wave, so on and so forth afterwards. So I think we need the education of the public needs to step up.
Now, as we go along, we've come to realize that there are a lot of things that COVID, some of the symptoms around COVID that we're getting to find out. I mean, at the latter part, we realized diarrhea in some people meant, and all. Were there any others in your level of work?
So yes, in case whenever somebody presents with red eye. Yeah. So that's a sign of an infection. We assume, or at least we consider the potential that it could be COVID related because it can. That's just one of the ways it can affect the eye.
And what was the traffic like in terms of your sport? I mean, a lot of people wanted to stay at home. A lot of people wanted to avoid hospitals and all that. Were people coming in as business as usual during the period?
Traffic did reduce, and I think that it reduced all around in all sectors, especially last year. But that was necessary because of the lockdown. The lockdown has lifted, and well, I will say we are not doing terribly, but we're not doing like we were doing before.
Okay. And then finally, did you ever take a COVID-19 test? And your period of wait, what was it like?
Right, so for our facility, fortunately, yeah, we took several. I think last year I must have taken no less than, at least once a month. At least.
Wow. At least one?
Yes, at least once a month, right? I've done a lot. I've done the serum type, I've done the sputum type.
What was the feeling like waiting? And did you think, oh my God, if I'd gotten it, would I die? You know, those kind of questions that...
That's an interesting question. So I will admit the first few months when it was announced that it was a national pandemic, yeah, there were concerns. But I think as a health worker, there's always this tendency to put the public at, you put the public first.